What if your body has been giving you quiet warnings about prostate cancer, and you've been overlooking them? Prostate cancer is one of the most common cancers among men, affecting millions every year. Yet, many men don't catch it early because it often begins with subtle, unexpected signs that are easy to dismiss. While symptoms like painful urination or blood in semen are well known, the truth is that prostate cancer doesn't always start that way. Instead, it often whispers its presence through vague, seemingly unrelated symptoms. In this video, we're uncovering 8 early warning signs of prostate cancer that most people don't talk about. These are the symptoms you need to know, even if you feel perfectly healthy today. And we're not stopping there. Before the video ends, we'll also share 6 science-backed strategies to drastically reduce your risk of ever developing prostate cancer. Remember, catching prostate cancer early could mean the difference between life and death. A staggering 98% of men diagnosed in the early stages survive, while late detection paints a much darker picture. Don't let these signs go unnoticed. Your health and your future deserve your attention. Let's dive in, starting with the first surprising sign that could save your life. 1. Frequent or weak urine flow. Frequent trips to the bathroom or noticing that your urine stream is weak or interrupted might seem like minor annoyances, but they can be critical early indicators of prostate issues. The prostate gland is located just below the bladder and surrounds the urethra, which carries urine out of the body. As prostate cancer develops, the abnormal growth of cells can enlarge the prostate, narrowing the urethra. This narrowing creates difficulty in urination, causing a slower or weaker stream and incomplete bladder emptying. A study published in the journal Prostate Cancer and Prostatic Diseases found that urinary symptoms, including weak flow and frequent urination, are often the first noticeable signs of prostate problems, including cancer. Chronic obstruction caused by an enlarged prostate can also strain the bladder, potentially leading to long-term complications if left untreated. Don't ignore persistent changes in urination, especially if they worsen over time. Early detection can make a dramatic difference in outcomes. 2. Persistent fatigue and weakness. Fatigue is a common experience, but when it becomes unrelenting and is paired with other symptoms, it may point to an underlying health issue, including prostate cancer. This fatigue isn't just about feeling tired. It's a profound lack of energy that doesn't improve with rest. One reason for this is the energy demands of cancer itself. A study in Nature Reviews Cancer explains how cancer cells hijack the body's energy reserves to fuel their rapid growth, leaving less energy for normal bodily functions. Additionally, prostate cancer can disrupt hormone levels, particularly testosterone, which plays a vital role in maintaining muscle strength, energy, and overall vitality. As testosterone levels decline, patients often report feeling weaker and less able to carry out everyday tasks. Combined with other symptoms, such as weight loss, changes in appetite, or urinary difficulties, persistent fatigue should raise a red flag and prompt medical evaluation. 3. Unexplained constipation. Constipation might not seem like a symptom of prostate cancer, but it can be linked, especially as the disease progresses. The prostate's location in front of the rectum means that an enlarging tumor can press against the rectum, disrupting normal bowel movements. This pressure can cause difficulty in passing stool, a sensation of incomplete evacuation, or even a change in stool shape or frequency. A study in the Journal of Clinical Gastroenterology highlighted the interplay between pelvic organ dysfunction and bowel habits, emphasizing that cancers in the pelvic region, including prostate cancer, can lead to gastrointestinal disturbances. Beyond physical obstruction, systemic inflammation caused by cancer can slow digestion, while hormonal changes, particularly decreased testosterone, may weaken the muscles involved in bowel movements. If constipation persists without an obvious explanation, like dietary changes or dehydration, and is accompanied by other symptoms, it's worth consulting a doctor. Early evaluation could reveal a serious underlying issue. 4. Pain while sitting. Sitting should be a simple, comfortable part of daily life, but for some men, it can become a source of relentless discomfort. If your prostate is enlarged, it can press against surrounding tissues, causing pain that radiates through your pelvic area and lower back. This pain isn't static. It may range from a dull ache to sharp, shooting sensations that make even a short sitting session unbearable. Studies suggest that persistent pelvic or lower back pain, especially during sitting, could be more than just a sign of prostate enlargement. It may point to prostate adenocarcinoma, the most common type of prostate cancer. The prostate's proximity to the pelvic nerves can exacerbate this pain as tumors grow and create pressure. Pain management strategies might provide temporary relief, but the real priority should be investigating the underlying cause. Your body uses pain as a warning system, and these signals should never be ignored. 5. Swelling in the legs or feet. Swelling in the lower body isn't always the result of a long day or too much salt. It can signal something far more serious. When prostate cancer spreads, it often targets the lymphatic system, a critical network of vessels and nodes responsible for filtering bodily fluids and fighting infections. If cancer infiltrates nearby lymph nodes, it can block fluid drainage, leading to noticeable swelling in your legs or feet. This swelling, known as lymphedema, occurs because the blocked lymphatic pathways can no longer function properly. Research highlights that cancer-related lymphedema is common in advanced prostate cancer cases, often accompanied by other signs like fatigue or pain. While swelling can also result from other conditions like heart or kidney disease, persistent lower body swelling, especially when paired with other symptoms, warrants immediate medical attention. Identifying and addressing this issue early can prevent complications and provide better treatment outcomes. 6. Unexplained weight loss. Losing weight without trying might sound appealing to some, but it can be a serious red flag. Cancer, including prostate cancer, is a major culprit behind unexplained weight loss, which often signals the body is battling an underlying issue. Prostate cancer-induced weight loss is typically a result of cancer cachexia, a metabolic condition where the tumor consumes excessive energy and nutrients. This process not only depletes fat stores, but also reduces muscle mass and strength. A 2020 study published in Cancer Medicine found that cachexia affects up to 80% of cancer patients and is linked to worse outcomes when left unmanaged. Prostate cancer can also alter hormones like testosterone, further impacting metabolism and energy balance. If you notice sudden, significant weight loss, especially alongside other symptoms, it's crucial to seek medical advice to rule out or diagnose prostate cancer early. 7. Erectile dysfunction. Erectile dysfunction, ED, is often dismissed as a side effect of aging or stress, but it can also be an early indicator of prostate cancer. Prostate cancer's location within the reproductive system places it near essential nerves and blood vessels responsible for achieving and maintaining an erection. As tumors grow, they may compress or invade these structures, disrupting blood flow and nerve signals. A 2017 study in the International Journal of Urology revealed that men with prostate cancer were more likely to experience ED even before receiving treatment, emphasizing the link between early-stage cancer and reproductive health challenges. In advanced cases, cancer may spread to pelvic lymph nodes or tissues, exacerbating nerve damage and making ED more severe. If erectile dysfunction arises unexpectedly, particularly in conjunction with other symptoms, it's worth exploring whether prostate changes might be the root cause. 8. Frequent urination at night. Are you making more trips to the bathroom than usual, especially at night? While occasional nocturia, frequent nighttime urination, might seem like a harmless inconvenience, it can be a clue pointing to prostate changes. Prostate cancer can cause the gland to enlarge, placing pressure on the bladder and urethra. This results in an increased urge to urinate, even when the bladder isn't full. A study published in BMC Urology in 2019 found that urinary symptoms like frequent urination or nocturia were common in men with undiagnosed prostate cancer. Nocturia doesn't just interrupt your sleep. It could be your body's way of signaling prostate dysfunction. Though aging, diabetes, or other conditions may also contribute, persistent nighttime urination alongside symptoms like weak urine flow or pelvic discomfort should prompt a medical checkup. Early detection can make all the difference in managing prostate health effectively. 6 proven strategies to significantly reduce your risk of prostate cancer. 1. Prioritize a plant-based diet. Extensive research highlights that diets rich in fruits, vegetables, and whole grains can lower the likelihood of prostate cancer. Cruciferous vegetables like broccoli, kale, and cauliflower stand out due to their sulforaphane content, a natural compound known to combat cancer cell growth. Additionally, tomatoes are an excellent choice because they contain lycopene, a powerful antioxidant linked to reduced prostate cancer risk. 2. Maintain a healthy weight. Being overweight, especially with excess fat, heightens the risk of aggressive prostate cancer. Extra fat fuels inflammation and disrupts hormone levels, both of which create conditions conducive to cancer development. Achieving and maintaining a healthy weight through a balanced diet and consistent exercise, such as 150 minutes of moderate activity per week, can significantly reduce this risk. 3. Add omega-3 fatty acids to your diet. Foods rich in omega-3s, like salmon, mackerel, and walnuts, offer protective benefits against prostate cancer. Omega-3 fatty acids are known to reduce inflammation and support prostate health. For plant-based options, consider flax seeds or chia seeds as nutritious additions to your meals. 4. Commit to regular exercise. Physical activity is a powerful tool in cancer prevention, as it boosts immune function, lowers inflammation, and balances insulin levels. Activities such as brisk walking, cycling, or strength training not only improve your overall health, but also help regulate hormones, reducing the risk of prostate cancer. 5. Reduce consumption of red and processed meats. Studies consistently show a link between high intake of red and processed meats and a greater risk of prostate cancer. These meats are often loaded with saturated fats and nitrates, which can fuel cancer growth. Swap them out for healthier alternatives like lean poultry, fish, or plant-based protein sources such as legumes and tofu. 6. Stay on top of screenings and manage risk factors. Proactive monitoring is essential for catching prostate cancer early. If you have a family history of the disease, consult your doctor about regular screenings. Additionally, controlling chronic conditions like high blood pressure, diabetes, and high cholesterol can create an environment less favorable for cancer to thrive. By incorporating these evidence-based habits into your routine, you can significantly lower your risk of prostate cancer while enhancing your overall quality of life.